My name is Kelly Henry. I'm a certified diabetes educator and a registered nurse, and I work for the Center for Excellence in Diabetes Education here in Northampton, Massachusetts. I'm going to be talking about how we treat diabetes. First, let me say that there's two types of diabetes, type 1 and type 2. With type 1 diabetes, people don't make insulin, so we need to replace the insulin. Their main treatment is to replace the insulin that they're not making. And also we look at lifestyle, the 7 healthy behaviors. The main thing though is to treat with insulin. With type 2, there's several different ways we can treat because there's several different reasons people have type 2 diabetes. With type 2, the main problem is that they have insulin resistance, which means the body doesn't utilize the insulin that they make as well as it should. And eventually they become insulin deficient or don't make enough insulin. The other piece that happens with type 2 diabetes is that they oversecrete sugar from the liver. Our livers store sugar for different times that we need it during the night, when we're fasting, when our growth hormone works, when our stress hormones work. All of these tell the liver to give us extra energy or sugar to help us fight or flee whatever is in front of us. So we need to have treatments that work for all three of those things. The best treatment and the most important treatment for type 2 diabetes is a healthy lifestyle, and that would be the 7 healthy lifestyles. So first we look at meal planning, we look at activity and or exercise, however you want to define it. And then we also look at stress reduction, which is very important. And then we look at coping and risk management and all the other little things that can go along with diabetes. With a healthy lifestyle, we want to look at meal planning, and some easy things for this would be to eat 3 meals a day. We always say don't drink your carbohydrates, which means that you don't want to drink soda, you don't want to drink juices, you don't want to drink a lot of Gatorade or a lot of the sports drinks, because these things all have sugar in them and they don't fill us up, they don't really give us any nutrient value, and we end up drinking sugar that doesn't give us any value. And then the other big piece is activity. We're very sedentary in our lifestyle in this country. We need to really find ways to be more active. It can be exercise, but it also can be just taking the stairs instead of the elevator. It can be parking the car farther away, so we have to walk farther to get to wherever we're going. There's lots of different ways to increase our activity. We always tell people you can dance at home by yourself versus exercise, because a lot of times people find exercise as a 4-letter word. So we try to call it activity. You can, when you're vacuuming the house, you can put more effort into it. Kind of move your whole body or use your whole body when you're doing these activities of daily living. And then, unfortunately, when there's not enough control in the blood sugar with lifestyle, we need to add medications. But the key word here is add. For a lot of people, lifestyle isn't enough, and down the road we need to add pills. If that's not enough, we add insulin. But the key word again is add. We don't stop one for the other. So again, to recap, the most important thing with type 2 diabetes is that you lead a healthy lifestyle. And even when you're on medications, you want to keep using that healthy lifestyle. And then with type 1 diabetes, we want to make sure that we treat with insulin, because without insulin, these people will die. Thank you.